it turns out there are things you can get into trouble with that because they tried to court-martial me. And luckily,
this story could go on and on and on.
I've seen a movie about court-martialing.
Yeah.
Well, we're talking about you.
About me.
Yeah.
And your stories.
And my stories. I have many stories, yes.
We'll focus on a few of them.
Yes. You're going to keep it down to a bare minimum, yes.
Yeah. Where are we starting, Amit?
Okay. Dr. Trescot. Queen of so many pain procedures and education of all these things I've learned from you, from WIP, Warner Institute of Pain. Your passions, you have so many. The ones I picked up from you, cryoablation, cryotherapy.
Correct.
I think a lot of the people who are listening, your contributions are integral to that success. Why freeze things when you could have burned them? What got you interested, and what's your story of why you thought cryoablation would be very helpful for your patients, and then teaching it?
Actually, I can trace it to the day. I was a brand new anesthesia resident in the Navy. And luck of the draw, my first rotation was anesthesia. And so everybody starts their residency on the 1st of July, and this was probably the 5th or 6th of July. And no one at my program at Bethesda, none of the attendings wanted to do pain. So they all went hiding in the back office someplace. Yeah. And in comes this young active duty guy with low back pain and leg pain. And he'd had 3 epidurals, not any better. And I'm going, I don't know what to do with you. I mean,
this is how it always starts.
It always starts, yeah. And
read a book.
Yeah, right. Yeah. And I said, well, show me where you hurt. And he points right to the top of the iliac crest. And I went, well, that's interesting. And I examined him right there. And he was exquisitely tender right in that spot. And I went, well, quadratus lumborum tendon. I don't know what's there, but there's nothing that I can get into trouble with, right? There are no major blood vessels. So still with no attending around, I drew up some medicines, injected it, pain went away instantly. And I went, wow, that's cool. And later, we went back, 5 minutes later, went back to the anatomy books and said, oh, that's the superior cluneal nerve. Actually, the cluneal nerve. I didn't even realize that there was more than one cluneal nerve.
Oh, wow.
And it turns out there are things you can get into trouble with that because they tried to court-martial me. And luckily,
this story could go on and on and on.
I've seen a movie about court-martialing.
Yeah, luckily he was a critical member of his team. His commanding officer had already called the commanding officer of the hospital, bragging about how I'd gotten him back to work, and they left me alone, but I was hooked. And then I would start to see these nerves, and most of them would get better, but the ones that didn't stay better, what do you do then? And I ran across an ad for a cryo machine. I tried to talk the Navy into doing it.
Was it Cooper Surgical?
It was before Cooper Surgical.
Before Cooper Surgical.
This was Wallach.
Oh, wow. Wallach before Cooper Surgical.
Well, before Cooper Surgical, yeah. And I called up the guy.
VHS versus DVD conversation.
Yes, exactly. It really is because I was. It really was.
Before VHS, we had Wallach and Cooper Surgical.
Yes,
I have no idea what any of these are.
the Wallach Westco and so
pre-Beatles maybe.
Yeah, really, I think it was. Well, I could tell you because 1991 when I got out of the military and set up my own pain clinic, the first thing I asked the hospital to do was to buy a cryo machine, because what do you do? These large myelinated nerves form neuromas if you try and burn them or try and use alcohol or anything like that. And so once I started identifying these peripheral nerves, then the only thing that made sense was to freeze them. Yes. And so that's how I got involved. And so they were all connected. And
obviously we have reasons in this country where cryoablation may not have taken off. But around the world, you've pain school, all the things you've done, have you seen cryoablation become more commonplace?
Absolutely. And in fact, this month, anesthesiology, the cover picture is a picture of cryo.
Oh, wow.
And so, yes, we did an article on post-mastectomy cryo, and it made the editorial and the cover of anesthesiology this month. So it really has felt like I've been dragging this technique kicking and screaming into the late 20th century. But
I mean, it's funny you say that because, like, for me, I obviously trained under Amitabh, and when he mentioned this to me about like kind of like it's funny because he's like a fanboy when he talks about you. I don't know if that's an accurate description.
I don't know what fanboy means.
Yeah, but as someone one of my favorite things that I love doing is cryo. He has one of the Frigitronic machines that I just love using, and I feel like like your description of like, let me find this nerve and let me cryo it and see what, and it works. Yeah. That's how I feel now. Like sometimes I'm like, oh, like we have these weird cancers, and it's like, what if we cryo somewhere around here? And it works. It's amazing.
Yeah. So the biggest problem has been it hadn't been taught in residencies and fellowships. And so, and that takes time. It takes generations really to get people they have to have an attending that knows how to do it, and has to have the equipment to be able to do it.
That's probably the hardest part.
That's the hardest part. Yeah.
It seems like the cryo was available before radiofrequency type ablation techniques, but the equipment was more cumbersome.
Correct.
And so it's been promoted to do thermal ablations or even chemical ablations, and cryoablation has been a little bit more of a niche in this country. And even though these devices are run around a lot longer than these thermal devices.
Well, it's funny too, because there was this whole thing about how RF needles are so much smaller and so much smaller and so much smaller. And now we're turning around and bigger is better. You know, the bigger lesion.
Like cooled. And then it confuses cryo.
Exactly. Cooled RF is the most confusing term I've ever heard because it makes no sense.
Yeah. What do you see like the future of like cryo? Is there any changes that you can make to make it better?
Well, there are actually some very innovative companies in Europe who have really taken off with cryo, and I'm trying to do a little bit of matchmaking to see if we can't bring some of that into the United States. And it is, I mean, ones that self-purge and talk to you and multiple languages and have various set protocols and actually, one has a curved probe with uninsulated areas for doing, just like the simplicities for doing this for the SI.
Wow.
Yeah. And so just really neat kinds of things that are being done. Some of the intraoperative cryos are really taking off. I got a chance to be part of a chest wall, an international chest wall symposium for the Nuss procedure, for the pectus excavatum. Actually, Dr. Nuss was there, and it was so cool. But they were showing videos of these kids who have, normally after a pectus surgery, you're 3 or 4 days in the hospital. This is breaking your ribs, moving your sternum, putting this big bar there. And the kids now are leaving the hospital in under 24 hours on no pain medicines with intraoperative or preoperative cryos.
What?
And the nice thing is the nerve regenerates.
Yeah.
So you're not talking about a long-term, completely denervated, destroyed architecture.
The path is still intact.
Yeah.
The path is still intact.
The low risk of neuromas. That's what you're saying in the beginning.
Yes, exactly.
And that's like the benefit over the conventional RFs.
Correct. If you take a piece of chicken, raw chicken, and you put it in the freezer and you pull it back out and defrost it, it looks exactly like what you put in the freezer. In fact, the grocer has to tell you that it was previously frozen because you have no way of knowing, right?
We see this when we do this in our ultrasound. We see the architecture of the muscle return back to normal in a cryo. With thermal ablation, you'll just see it coagulate. It looks very different. It looks scarred.
Yeah, we'll put a piece of chicken on the grill. You've got the heat and the spatter and the coag. The chicken never looks the same.
Eat your chicken by thermal ablation.
Yes,
it tastes a little bit better.
Tastes better than frozen.
It tastes better when it's cooked.
Don't cryoablate your chicken.
Don't cryoablate your chicken
for your grill.
But maybe your fish. Maybe your fish if you're a sushi fan.
Sushi.
Yeah, definitely.
Wow, this has been great. Thank you very much.
It's been my pleasure.
Yeah, thanks for stopping by.
Nice idea. Thanks for including me.
Yeah.